Nostega,
Yes, please.
okay, please, you do us the favor of going first. We are live and about to start until Dr. Shundara gets in. Thank you.
Okay. All right. Let me turn on my camera. Hope you guys can see me. Of course. Yeah. So should I carry on?
Okay,
Yes.
just hold on now.
Okay.
Okay, welcome. Good evening, good evening, good evening from wherever you are connected, from wherever you are joining us from. This is the much awaited day where we talk about something beautiful coming from the stables of Viva Femini. It's the 13th day of February. I know you have all been waiting for it. And just as I have also been looking forward to this day because we have packaged something wonderful for every woman out there, whether you are a mother or yet to be a mom, you are going to learn something today that will help you, be a better woman, even to the next woman that comes your way. And tonight, or this evening, we have two amazing speakers that are going to be doing justice to the topic birth, bump birth, and beyond. Now, having women in the society is something that is just amazing. We are life givers, and the whole process of bringing life to the world is simply amazing. I hope that every woman will have the privilege of experiencing that. So, and with that kind of wonder that God has made, recreation or procreation, it doesn't always come so smoothly. So we are here to talk about all the little details that some women face and some of the challenges that others have to go through. With us to do justice to this topic, born, birth, and beyond, we have two amazing professionals, and we will give them time to download from their wealth of experience, and then we'll have a chance to ask questions, and of course they will do their best to answer each and every question that we have. So, first of all, I want to introduce our first speaker because I just want us to dive into this so that I know how eager we are to learn. I know how eager we are to, just get in on the show. So, let me just quickly go without further ado to introduce our first speaker. She is a woman of many hearts. She's a woman who is vested in her craft, in her profession. She's a woman who is passionate about women's health. And you know us at Viva Femini, we only bring you the best. And because Viva Femini is the prime stable of women's health, we had to go all the way to bring this amazing woman to come and do justice to this topic and educate us on everything pregnancy. So please join me with your best emoji to welcome her. Her name is no other but Dr. Oluwakemi Oshundara, the resident doctor obstetrics and gynecology, UCH Ibadan. She, like I said, she is a passionate doctor, passionate woman when it comes to women's health, and she is going to help us, understand everything about women, pregnancy, and beyond. Beyond that, she's a singer, a dancer, a wife, and a mom. So take it from me, she understands this topic, and you are going to learn a lot. So we welcome you, Dr. Shundara. Welcome to this amazing time with the Viva Femini clan. Please welcome her with all the emojis and all the clap icons that you can find. Welcome, Dr. Shundara. Please take the floor.
Thank you very much. Good evening, everyone. Like I've been introduced, I'm Kemi Oshundara, and I'm a senior registrar at the University College Hospital Ibadan. We will be discussing about pregnancy this evening, and I will want everyone to please listen very attentively and feel free to ask any question that you may have, or anything that is bothering you. You can share and we can talk about it as much as time permits. So, like I've said, we want to talk about pregnancy and pregnant women generally. When someone is pregnant, I've met a lot of people that will ask me, when do you think I should book for my antenatal when I'm pregnant? Yes, if you as when once you have missed your menses, you're supposed to see it and you did not see it, then you should do your pregnancy test, whether urine pregnancy test or blood pregnancy test. Definitely, once it's positive, wait for another 4 weeks, which will be 8 weeks. So from that 8 weeks, do an ultrasound scan, and then you can go ahead to book in a hospital. Yeah, the benefit of booking early is they are numerous, and booking early will make the doctor or the healthcare workers to know your baselines, your blood pressure, your blood sugar, your urinalysis, your packed cell volume, because as at that time your blood level is still as good as when you have not gotten pregnant. So they will know the starting point, so that if there's any changes along the line, if there's a reduction or something, it will be noted. Those are the benefits of booking early, so that if as time goes on during pregnancy, if there's any changes in your urine when urinalysis is done, or in your blood pressure, definitely it will be picked, and this will help to manage whatever it is, so that we can so that treatment can be commenced as soon as possible. There are various dangers that can happen during pregnancy. The first one that I would like to talk about is the high blood pressure, hypertension, as it is called. It's very dangerous and may be common. It's somehow common during pregnancy, because pregnancy itself can actually predispose a woman to high blood pressure. And once that one starts, if it's picked early, of course it's manageable, and it can of course the pregnancy can grow to maturity, till when baby can be delivered. But if someone did not book early, you are just coming maybe after 4, 5, 6 months to book, we don't know the preliminary. We don't know if you had the high blood pressure before the pregnancy, or is the pregnancy that is causing the high blood pressure. So it's somehow, though we'll treat definitely, but it's difficult to differentiate between somebody who has had high blood pressure before pregnancy, or somebody that is having it just in pregnancy, because we have different ways of managing those cases. And still in line with the high blood pressure, there's something we call preeclampsia. Preeclampsia is when the blood pressure is elevated and there is protein in the urine. That's why it's very important. Antenatal is important, because of course there is no antenatal. I don't know, there are some centers that may not do that, but in standard places you must do urinalysis at every clinic visit. That's urine test. They will check your urine. There are a lot of parameters that are checked in the urine. From your urine, we can pick if you are diabetic or about to be diabetic. We can pick if you are dehydrated. We can pick if you have preeclampsia. We can pick signs of infection from the urine. So you can see that antenatal is a very good thing, and it really goes a long way in preventing a lot of things in pregnancy, a lot of complications in pregnancy. So preeclampsia is when the blood pressure is high and there is protein in the urine. It's a very dangerous thing because it's a progressive disease if it's not well managed. So, but once we pick this, of course, there is a way we manage and see how we can salvage the situation and see how the pregnancy can actually result into a live birth. But at times the pregnancy may be so maybe a very bad one that even without waiting for maturity, we will want to deliver the baby as soon as possible. It happens. So please, I'm imploring all pregnant women and those who are still intending to get pregnant. Antenatal is a very important thing that should be done. There are a lot of people you will see they say, I did not even attend any antenatal and I deliver my baby safely. Yes, of course, there are people like that. There are people that will say, since I've been going to antenatal, nothing has been picked, there is no abnormality, everything has been fine. Yes, but when something will go wrong, it is at this same antenatal that it will be picked, which is better. Another thing, apart from the high blood pressure and the preeclampsia, is something we call diabetes mellitus. There are people that have diabetes before pregnancy. Their own management is different. And there are people that have something we call gestational diabetes mellitus. That's a diabetes that is caused by the pregnancy. Pregnancy can actually induce diabetes. And in these cases, of course, is manageable. But you will see some people, they will just say, one, God forbid though, but you will see that they will say somebody just had stillbirth, no cause was found. But see, during antenatal, a lot of things can be done, and some things can actually be picked and prevent all these stillbirths that people do have. So somebody that have gestational diabetes or diabetes generally before pregnancy, if the blood sugar is not well regulated, it's a very dangerous thing to both the mother and the baby. High blood sugar can actually affect the baby once the mother's blood sugar is too high, above the normal level. Definitely, it's the same blood that is getting to the baby, and that is dangerous, at the same time dangerous to the mother. These actually have ways by which we can manage, we can regulate the blood sugar and ensure that, okay, the mother's blood glucose level is normal, and then pregnancy can be carried on, and then the delivery can be planned along the way as the mother is being managed. I think those are the major things that happen. There's this condition also. There are some people that have blood group that is they are resource negative. They can be O, they can be B, they can be AB, they can be A. But there's resource factor is negative. The resource factor is like an antigen in the blood, but it's not harmful. It's not it's not a disease actually, it's just their blood type. But where it is dangerous is when a woman that is resource negative gets pregnant in her first pregnancy. If the husband is also resource negative, all well and good, the baby will definitely be negative. But if the husband is resource positive and the mother is resource negative, so the baby that the mother will carry can either be resource negative or resource positive. If the baby is resource negative, fine, there's no danger. But if the baby is resource positive, also all well and good with that particular pregnancy, that first pregnancy in which the baby is resource positive and the mother is negative, of course the pregnancy will go well and baby will be delivered. But there's an injection that the mother must take after delivery. Usually, in fact, sometimes we give during pregnancy, depending on the titer, the level of the resource in the blood. There are tests that we will do that can help us to actually detect if the mother has been sensitized to a resource positive blood through that positive pregnancy. So if that occurs, even if it doesn't occur, most of the time we say prevention is better than cure. So there is an injection that the woman that is resource negative must get in order to prevent her from being sensitive to resource positive blood. Of course, the first pregnancy that is resource positive will go well, baby will be delivered. If that injection is not taken, the mother's blood will be sensitized to resource negative blood. And so when the mother gets pregnant again in the second pregnancy, and that same baby, that second baby is resource positive, there is going to be a problem. Because the mother has been sensitized to a resource positive blood, the mother's body sees that baby that has resource positive blood as a foreign body. Then it results into miscarriage. Sometimes the baby will just be abnormal, a lot of difficulties, and so on. So it's very important, not just going to antenatal. Please, I would like to implore us. There are a lot of people, they will say they are going to antenatal, but they don't even know what they are doing for them. Some don't even know the medications they take. They just go to the clinic, whatever they tell them, that is all. They don't ask questions. Please ask questions. When you go to antenatal clinic, make sure it is a place where they know what they are doing. I've seen someone, even though this is not antenatal, that her blood sugar was very high. About 3 days before I had an encounter with her, her blood sugar was 390 something, which is way, way, way very too high. And then she checked it at a private, no, sorry, at a primary health care center, and they told her it's normal. Then she went home, but she wasn't fine. She was feeling weak. She was so sick. And about 4 days later, I had an encounter with her. And while I was asking questions, I said, "Do you have diabetes?" She said no, that she checked her blood sugar some days ago and they told her it's normal. Okay, what was the value? She brought out the paper where the wrote it was 394. Ah, madam, 394. Some people's blood sugar will not be as high as that, and they will even go unconscious, and some may die from there. So, not just attending antenatal, be sure, especially in Nigeria, where there are a lot of things going on, things are not well regulated, especially when it comes to healthcare. So please ensure that where you are getting your antenatal care is where they know what they are doing, and you can be rest assured that you are getting the best of care, so that if anything is going wrong, you will know, they will know, they will tell you, then it will be well managed. um I think majorly this is what I want to say. Another thing that may be very dangerous, and that mothers should please don't ignore any sign, anything that wasn't there before and is just happening now. Please don't ignore. Make sure you see your health care center. So in order to be well managed. There are some people when they are pregnant, definitely a pregnant woman will start feeling baby's movements. Some from 18 weeks to like 20 weeks, especially in the first pregnancy, they feel the baby's movement late. But there are some people that as the pregnancy is growing, the baby, definitely as they are growing bigger, you feel the kicks the more. So some people will start having reduced baby's movements, and then they will be like, "Hey, I'm still watching it." Please don't watch. If anything is going to happen to baby, usually the movements will start reducing. When an adult, even not a normal human being, is sick or getting tired, definitely your movement will be reduced. Something can be done. It's better to go to hospital and they tell you, "Madam, don't worry, we have checked you, we have checked your baby, everything is fine, please go home," than for you to just be at home and think you are watching it. Some babies might die from that, and um that's a very bad thing. So I hope with these little things that I've said, I've been able to bring out some points that you understand, and I'm sure there will be time for question and answers. Thank you very much.
Yes, thank you so much, Doctor. Actually, we want to bring in some questions right away because these women have been waiting for this webinar to hear you speak to them, educate them, and there are questions that are already waiting. So let me just bring out one in line with what you just talked about. So somebody wrote in saying, "I am 20 weeks pregnant and I get very frequent headaches. I take plenty of water and my blood pressure is good. What could be the cause?"
Okay, thank you very much. Do you get enough rest? That's the question I want to ask. Anything, there are a lot of things that can actually cause headache. Stress can cause headache. There is what we call tension headache, there is stress headache. Some people have migraine and so many other things. So you really need to see your doctor and know what could be causing the headache. It might be stress, maybe you don't get enough sleep, maybe you are stressed at work and so on. So this is something that should really be checked. If you are sure your blood pressure is fine, even malaria can cause headache. So please, it's something that should be checked in a hospital and be sure of what is actually causing the headache. Hello, can anybody hear me?
Okay, we can hear you, Ma.
Okay,
So
okay.
there's another question here that someone else asked, and she's saying, what can make a woman to have delay for 6 years after first childbirth, which was through CS?
Okay. Yeah, a lot of things can happen. During the CS, of course, it's a surgery which is usually done under asepsis, like we prevent infection by all means. Some people may have infection after the surgery, infection of the inner lining of the womb. We call it endometritis. That If that happen, sometimes if it's treated, well treated, it resolves and everything goes fine. Sometimes the infection may extend from the inner lining of the womb to the tube. And for someone to get pregnant, definitely the fallopian tube must be patent, must be open. So we don't know if there's something that is blocking the tubes. What actually happened around the surgery can affect a lot of things. So it depends on what was done at the surgery. And sometimes you may be surprised that even after all the test has been done, everything has been checked, hormonal imbalance. So it might not even be related to the surgery at all. There are a lot of people that have done 3 4 CS and they are still able to get pregnant afterwards. So it might not really be from the CS. It might be, maybe was infection or something, or it might be hormonal imbalance, or even, most of the times, especially in our environment, Nigeria, when there is infertility, we usually look at the woman too also, because infertility cases, we have discovered that 30% of infertility cases is from the men, is from the male factor. So um the both couples should be checked, not just because she was not able to it was the husband that impregnated her, does not mean that the husband's sperm cannot have abnormality. So the two of them should be checked, whether the wife and the husband, to be sure what is actually causing the delay. Thank you very much.
Thank you so much, Ma. Before
Yeah.
we let you go and bring in the next speaker, I just want to crave your indulgence. Please answer this for our audience. It seems in line with the other one, but I'll let you be the judge of that. And the question goes, I've been married for 8 years now, but no conception or miscarriages. What kind of test should my husband and I do to confirm that we are fertile?
Yeah. Actually, it's a big deal for us in this environment. But do you know, 8 years? That's a very long way, a very long time. Why are you waiting till it's 8 years? By the time a couple gets married and within 1 year of living together, not husband that travels and comes back, those ones will tell you you are not ready for pregnancy. But if you be living together for 1 year and you have regular sexual intercourse, what is regular medically is at least 3 days in a week. to have sexual intercourse. And if you have done that for 1 year and you are not getting pregnant, then you should visit a hospital. So 8 years is a very long way, but it's okay. There are a lot of tests that will be done on both the woman and the man. Now, it's not something that should be done in a kind of meeting, like it's not in this kind of program that will be saying, okay, go and do this, go and do that. No, that's not ethical medically. So you will need to go to a hospital, not just hospital, see a gynecologist. They know what test to write for you. They will test if you are still ovulating. They will test if your tubes, your fallopian tubes are open, because it is in the fallopian tube that the sperm and the egg will meet to fertilize and then become a pregnancy. So they'll check if you are ovulating, that's if you are laying egg every month. If you still have eggs, there are tests to be done. If your tube is open, there are tests to be done. If your husband's sperm is good enough to impregnate a woman, there are tests to be done. So please visit a gynecologist about the tests that you are going to do. Thank you.
Thank you so very much, Ma. We can feel your wealth of knowledge already bringing down all the walls of ignorance, and our women are glad for it. We hope that you will still be on hand to answer questions, because the questions are piling in. Thank you so much for this
Okay.
session, and
Thank you.
we pray that you have more grace to do what you're doing for women across Nigeria, because we need more people to care about women and their health. Thank you so very much, Ma.
Thank you, ma'am. Thank you for having me.
Thank you so
Yeah.
much. So, women, ladies, men, audience, everyone, you have heard it. There is a whole lot that women need when they're pregnant. They need to do this, they need to do that. I hope we're taking notes, and I hope that we're learning something to share with even those who are not here. And it's not too late. You can share the link, you can ring them up and say it's happening live on YouTube. Come and be part of this conversation. Come and learn how to do things. Come and learn how to be a mother. Come and learn how to, go about all these challenges that women face in pregnancy. So please share the link, share it on your WhatsApp handle, your social media handles, share it and let everyone know what is happening right here. Okay, so at this point, we are going to be calling upon our second speaker for the night, and we are most grateful that she has found the time to speak with us and also share her wealth of experience and expertise. No time to waste. I want to specially call on a wonderful woman, and she is a Nigerian and UK registered nurse and a youth advocate, passionate about empowering young people through education, mentorship, purposeful living, you name it. She is passionate, and when you interact with her, you will attest to it. Well, you will listen to her in a bit. So she runs a YouTube channel. You can look her up. It's called Wholesome Health with Nostega, and a TikTok platform. She is passionate about sharing health education, life guidance, and inspirational content. But this evening, she wants to lend her voice to help us understand all these things we've been talking about, bomb, birth, and beyond. So, with your best emoji, I know we are attentive, we're on the call. Please help me welcome Tega Victor Oje from the UK, all the way from the other part of the world. Okay, so please let's make welcome Nostega. Hello, Nostega.
Good evening, everyone. Thank you so much for
Evening.
having me here. I heard all the many
We
plenty
are
things that you read. Thank you so much.
we are glad.
I am
You're
so
welcome.
excited. I'm so excited to be here. And I really want to say thank you to Mr. Felix. I see the wonderful thing he's doing, the wonderful job he's doing. I stumbled on the WhatsApp group and something I saw. I think they were playing a game and then it said, what's one word you would give to Viva Femini? And somebody said empowerment. And I think he gave the winner to that person. Such an awesome job because the WhatsApp group itself, it's a learning platform. Some of these things you think that you know them, but you just keep learning and learning every day. So well done for the work you're doing. So today, because of the topic, I will try to capture everything because this topic is huge. We're talking about bump pregnancy, we're talking about beyond, and we're talking about even for the newborn and for the woman that has delivered, how will she recover? And I really want to say thank you to Dr. Kemi. She did a great job talking about the need for antenatal care. And that was really, really beautiful. I tried to listen to all the things she said. It's really crucial. The truth is that once a woman is able to um, maximize antenatal very well, she will have a successful pregnancy, not just a successful pregnancy, but she will also have a healthy baby and, of course, a healthy mother. So quickly, I'll just use my slide as a guide so we can, capture everything. And then while I'm talking, I'm sure I'm going to capture some of your questions as well. So today we explore, so please, you can take the slide to where I am right now, Joy D, yeah? Yeah. So today's journey, let's explore pregnancy care, labor and delivery support, um, postpartum recovery, newborn essentials. When you have a new baby, how should you care for your baby? Being a nurse, by God's grace, I've been exposed to, these kind of things. And sometimes as women, we have myths. We have some perception that this is how it should be. This is how my mom did it. But if it's not scientific and if it does not give good outcome, then it shouldn't be practiced. Okay. And then we'll take questions and answer. I will try to do it in 15 minutes because the time is not so much. So understanding pregnancy, what to expect in pregnancy. There are different changes that will occur when you're pregnant, of course. There will be physical changes, emotional changes, hormonal shifts, and what's normal versus what needs your attention. So when a woman is pregnant, of course, you know that there are 3 trimesters: the first trimester, second trimester, and the third trimester. When should you, I think one of the questions that someone was asking is, when should you really go for antenatal? So once you are like 10, within as early as 10 weeks, before 10 weeks, you should already have that booking. You should already register yourself to a GP, to a doctor, and say, okay, let's run the test. They should already have your database, and then your care can start from there, because even before 10 weeks, anything can go wrong. So it is never too early to start. The moment you know you're pregnant, preferably before 10 weeks, do that registration and start your antenatal care. There are physical changes. Of course, you know that some of the physical changes, you may begin to gain weight. Some people may begin to become lean, probably because they are, not eating well. So there are a lot of physical changes, and I'm sure you know all of that. Emotional changes. Sometimes the pregnant woman may have those mood swings. Sometimes she feels, she may feel teary and all that. Hormonal shifts. There are some hormones that will go up and some that will be reduced because of this new shift that has occurred. So what is normal versus what is normal? In the course of when a woman is pregnant, we'll try and look at it. When should you know that, I'm in labor, or this requires attention? Should I go to the doctor or not? Pregnancy is a whole body experience, right? Like I said on that slide. So essential antenatal care, this one is a no-brainer. Regular antenatal visits. I think Dr. Kemi has really talked about that. If you have any underlying condition like diabetes, hypertension, this will be, spot early, right? This will be if some people, they may not really have any condition before the pregnancy, but the pregnancy could lead to that. I've heard of people who lost their eyes, not like it happened at once, it happened gradually, because their body showed them signs of the possibility and then they ignored. Some people have ear loss because of pregnancy. So at each stage of your antenatal, whether in your first trimester, second trimester, third trimester, these conditions that are possibility, your doctor will pick them up and then they will begin to monitor you like that. There are people who have been sickle cell, they have successfully carried pregnancy. Why? Because they paid attention, they were intentional about their pregnancy journey. Okay, so regular antenatal visits, that one can never be overemphasized. Balanced nutrition, hydration, very, very important. As a pregnant woman, you want to hydrate yourself even more than an average person. I know that, of course, you will urinate frequently because already the baby is pressing on your uterus, so that will already make you urinate frequently, but don't let it discourage you. Hydrate as much as you can. Have a balanced nutrition, food that are rich in protein, calcium. Have good nutrition. Try to have a balanced diet as much as possible for yourself and for your baby. There are supplements that are advised by, healthcare professionals for you to take, like folic acid, calcium. These ones, you cannot even take it away, right? There are some vitamins that you should avoid, like vitamin A, for example. It's not healthy during pregnancy. So usually there is a pack of supplements that they give to you. I think folic acid is there. What's it called? Calcium is there, vitamin C. So it's already like packed. When I was working in O&G, that's gynecology, I know we usually pack those medications. We don't try to add or even subtract. For example, if you are taking calcium, you need to space it with iron, for example, because calcium will lower the absorption of iron. So it's not as if because you are pregnant, every vitamin that you see, you just want to take it, So take that with precaution and, of course, with the guidance of your healthcare provider. Safe activity as much as possible. Try and engage in exercise if you can as a pregnant woman. Take your mental well-being seriously. Good antenatal care is the foundation of a healthy pregnancy. So let me run red flags to never ignore. I'm sure this one we want to hear it. What should you not look away from? If you're having severe headache as a pregnant woman, headache can occur occasionally, but if it's becoming severe, then you should not occur it. And don't just go and carry any medication you see and take, because some medications may not be healthy for your baby, because now you're not just thinking about yourself alone. There are some things you can tolerate, but your baby cannot tolerate it because your baby is still fragile. So that's why you must be mindful. If you're having severe headache, you need to go to the doctor. If you're having vaginal bleeding, you're not supposed to have vaginal bleeding when you are pregnant. So that's a red flag. If you're having reduced fetal movement, if, for example, you always notice that your baby moves, your baby will definitely move. There are sometimes when you may say something and your baby responds, so you should have those movements. But all of a sudden your baby is not moving, you don't fold your hands, you don't say, I beg, tomorrow I will go. No, you look at it immediately. Swelling in the face, persistent abdominal pain, visual disturbances. I've told you that someone has lost her eyesight because of pregnancy. So these signs require immediate attention. All right, so let's look at signs that labor is near. There's some of these signs, it may mean that within the next few days labor is near. For example, when you notice that your bum is already getting to your pelvic area, is already coming down, it means that the baby is already trying to turn to the right cephalic position for the baby to come out. So that's a sign. Some people may notice back pain. That's a sign. Some people may notice that they have show. You know what is show? Sometimes it could be pinkish or bloody in nature. Is that just that discharge that comes out from your vagina? It means that your labor is close. But how do you differentiate that between a labor that is really, really close, like within 1 hour to 24 hours? The difference is, for that kind of a labor, you are not just having back pain, but when the contraction comes, there's a rule we call 511. You can experience that contraction for 5 minutes. Sorry, you can within the space of 5 minutes, you can experience that contraction for 5 minutes, and then you have like a 1 minute rest, and then it continues like that for an hour, like that kind of continuous, consistent contraction. You already know that this one water don't pass Gary. You cannot now say you want to just relax and say, tomorrow I'll go to the hospital. You know that you need to carry yourself to the hospital. And some women have this nesting instinct, meaning they just want to arrange their house, they just want to put things in order. There's just that instinct that, like the beds, you just want to put things in order, and when it's very, very close, within that 1 hour to 24 hours, your water, of course, will break. At least that one, you know that your baby is here. And for the show, it only means that the cervix is beginning to open, beginning to warm up, beginning to open. So the show may not really be urgent, but once the contraction becomes consistent like that, at that kind of interval, 5 minutes interval, and then within the space of 1 hour, you are having it like that, and each contraction can last for 1 minute, you know that you are really, really due. So you should go to the hospital when you experience that kind of, let me just quickly say this, every woman's labor journey is unique, but these signs are common. Some people will tell you, when I was pregnant, this was how I felt, this was how I knew that my baby was coming. Other people may not experience it like that. So you cannot really base your own journey with someone else's, but there are just some cardinal points that tells you that this is it. Okay, so let's look at pain management options. If you're going to the hospital, you have different options to try. I want to believe that this is the 21st century and nobody should really have a trophy to say, I did a vaginal delivery, I did not have any medication, I did it myself. So some people have lost their lives because they have this ideology that, you know what, it must be vaginal birth, it will not be CS, I will not take any this thing. You are not trying to impress anybody. The most important thing is that you are alive, your baby is alive, both of you are healthy. So whatever works best for you. If you are in so much pain, the contraction is heavy, there are different options. You can decide to go with epidural. That's when the pain medication is being given in your spinal nerve, right? Some people may have this fear of, will the medication affect my baby? The chances of that medication crossing the placenta, it's very, very few. A little, it may make, it doesn't, the risk is very little. So as much as you can, you want to be comfortable, you want to go through your vaginal birth with ease and steeze. I know, no matter how it is, it's not an easy thing. Some people use gas and air. They call it Entonox. That's other options you can consider. Of course, at that initial stage when you notice that you are beginning to come into labor, you can engage in deep breathing exercise. It's not going to take all the pain away, but it can help you. Movement, positioning. Some people like to walk the stairs. Some people like to pace around. Some people want to have warm baths, massage, music. Of course, that's still at the beginning stage. But once you are like your cervix is fully dilated, you won't even have time to do those things, right? But these are just some options you can begin to consider. So what is the role of a birth partner? You are pregnant, you should have a support system. Your partner should be there to give you emotional support, should be there to advocate for you. There are sometimes you may be in that delivery room, you don't even know what the so you don't know what's happening, but your partner going with you to the hospital, your partner will be able to advocate for you and say, you know what, doctor, as it is, let's make the best decision for my wife. So, and when you deliver, you need support system around you, your mom, you need encouragement, you need as much comfort as you can. So for postpartum recovery, see, I'm just rushing through because I'm trying to manage time. For the first 6 weeks, you need lots of rest, you need nutrition, hydration, pelvic floor exercise. There are some pelvic floor exercises you can do. You can check on YouTube, pelvic floor exercise for a new mom, emotional checking, some gentle movement. Don't involve in too much rigorous activity, even if exercise is good, but you also want to be careful because you may be healing. If you had a vaginal delivery, you may actually have a episiotomy, the wound will be healing, so you don't want anything stressful and rigorous. Even if you have a CS, you may be healing, so you don't want anything really, really stressful. So it's a sacred time of healing, like I wrote there. So postpartum mental health versus baby blues. How can we tell the difference really? For baby blues, I believe most women experience what we call baby blues. It just means that feeling of overwhelm, and some mothers, they become teary at that time. Oh yes, I'm wrapping up now. They become teary, they want to cry, they become emotional, they become overwhelmed. Oh, is this me? Am I having a child? Do I have a child? So that's different from, depression. Depression is extreme withdrawal. Some women even hate their babies. At that time, they become very irritable. So that's the difference. And that's when you should really seek medical attention. So I wrote physical recovery that you can consider. All right, let me rush. Newborn essentials. How do you take care of a newborn? There are some feeding cues that your baby is giving you. You know that this baby is hungry. So your baby may not communicate in words, but they communicate anyway, even if they don't talk. Anyway, I have been asked to wrap up now. So I would like to stop here and maybe we take questions, but I wanted to speak about all of these because I tried to capture the topic, but that's fine. So let's carry on with our questions. Yeah. Since I was asked to wrap up.
Nastega,
Yes.
Yes, we can still get to the questions if you're going to take. I'm sure the slides that are left are just a few, and you're doing wonderful already.
Okay, so do you want me to continue then?
Carry on.
Okay,
yes,
thank you.
You can go ahead and finish this.
Thank you. So for your newborn, how do you understand your newborn? For example, for feeding, for example, your newborn may not speak, but when they move their mouth, you know that this baby is hungry. Sleeping patterns, for example, there's how you should carry your baby to sleep. There's an acronym called ABC of newborn sleep. Always sleep your baby on their back in a clear cot or a sleep space. There was a story in the Bible where a woman rolled on top of her child. So while I, try to make the slide for this, that was the picture that just came to my mind. And one beautiful reason why you should really practice this. I know it's not easy. Some of these babies, they're very attached. But as much as you can, try and keep your baby in his or her own cot. Always sleep them on their back. You shouldn't sleep them, facing forward, but they should face up as much as you can for a newborn. So that's one way, to avoid anything. Bathing basics, for example. There's no reason why you should be bathing a newborn 2 times a day or every day. If you can, preferably 2 to 3 times a week is enough for a newborn, right? And then as the baby progresses from 1 week, 2 weeks, you can decide to do every day. And when you are doing every day, please don't go and carry heavy sponge and soap. Like the baby is not jeans that you're watching. You can use a towel. You can use fragrance, soap that are free from fragrance as much as you can, or if at all, avoid soap. At that 2 weeks, some of us, anyway, will learn on the job. Some of us will learn by experience, you know. Cord care. How do you care for a cord? There are signs that you should notice that this cord is not, when you are when your baby has a cord, you have to be very, very observant. Monitor signs of redness in the cord, bleeding. That's something you should give attention to. The baby can bleed through that cord, but if it's properly clamped, there shouldn't be any issue. So you don't have to wipe with alcohol swab unless you were asked by your doctor or your midwife to do so. If not, all you need to do, just as you are using the towel and the warm water, at least 37-degree, you can measure the temperature of your baby water. While you are bathing your water, your baby, you can dap also with that towel. The key is to maintain that cord to be dry and clean at all times. Expose it to air. Even when you're wearing your baby a diaper, the diaper should be underneath the cord. You shouldn't use the diaper to cover the cord, because you want to ensure that that cord is not contaminated with a pee, because the cord can be infected by that kind of, by that kind of thing. So let's move on to when to seek help. When you notice your baby is having fever, poor feeding, your baby is not feeding well, tiredness, breathing difficulties, and when jaundice, for example, is getting worse, these are things you need to take in seriously. Just to note that, because I believe I'm speaking to a global audience, I try to add this slide. Cultural differences in birth and parenting is something that we should understand. For example, I believe the British culture, they don't believe in circumcision, but in Africa, we take it very seriously. So as much as you can, follow your instinct, follow your cultural beliefs that you think is safe. The key is safety. When you eventually say you must circumcise your child, please make sure that whoever you are contracting to do that job is an expert, is trained to do the job, because you don't want to cause the baby further harm. And then, of course, we know that FGM, female genital mutilation, is off. That one is off. No matter the cultural standpoint you are in, that one is a no-go area. So, but we should just understand that some of our culture, they are actually safe. I remember in those days, how they give birth was, they usually used to squat to give birth, and all of a sudden the Western world came and said, oh, that's not right. You need to lie on your back and flex your legs wide open. Funny enough, now we are now going back to that same method that we thought was primitive. So you see, some of our beliefs, our traditions, some of our safe medicine that we practice, they are actually good. The key is safety at all times. That's what you should be thinking of. Is this safe for my baby? Is this safe for me? I wrote here, culture shapes birth, but safety must always lead the goal. So how do we handle that? Is by education, by what we are doing now. And thanks to Viva Femini for this amazing job they are doing. Your faith is important as a pregnant woman, as a new mom. Your faith is very important. Final thoughts. Every mother deserves support. Every baby deserves safe start. Every family can thrive with the right knowledge. And that is why platforms like Viva Femini matter. Okay, so I think I'm ready for your questions. So let's talk.
Thank you so much. You have done great justice to this question and this topic, and we are so grateful that you took out time to arrange such beautiful slides to make the education and the comprehension complete. Thank you so much. So we can't let you go without answering some questions, because people have questions, and this is one of them. So please help us answer. She's saying, is it normal for milk supply to fluctuate? And how can it be improved safely?
Absolutely, absolutely. Thank you for that brilliant question. It's very normal, and you shouldn't feel like it's weird. Why is all of a sudden breast milk was flowing and now it's not flowing? It's possible for it to fluctuate. For example, stress can make it fluctuate. If your baby is not latching well, not latching on your areola, you remember that there was a picture that came to my mind. There are some mothers' areola that can be very big, and the ideal thing is for the baby to, take all of that to their tiny mouth. And you can see that some of these babies, they struggle. So, if the baby is having difficulty latching on the milk, it can be really difficult. And the thing about breast milk is that it works on demand and supply. So what that means is, as much as you can, if there is frequent sucking of the breast milk, the milk will flow. You won't have issues. So what support would I say you should do differently? Try as much as you can to make sure that your baby is sucking your breast milk frequently. Okay? Like up to 12 times a day. And those times where your baby is not sucking, you can extract your breast milk. Because the key is, constant latching on it, that's what stimulates the brain cells and the organs responsible for that to produce more breast milk. And I can't even not say that food is not important. What's your diet like? What are you eating? Sometimes your hormones could get in the way also. Stress can get in the way. So you want to make sure that you are having enough rest. You want to make sure that you are hydrating well as well. You want to make sure that you are drinking well. You want to make sure that your baby is, you are positioning your baby to latch on your breast milk properly. The times your baby is not sucking, as much as you can, extract. Even if it's not coming as, try and extract the breast milk. Okay, so I think that would help as well.
Okay, thank you so very much. I'm sure the person that asked that question has learned a thing or two. So please, Nostega, don't go away. We still have a question for you, but this one is for Dr. Kemi. So someone is asking, what kind of pregnancy, which kind of pregnancy can be managed in a primary health care, and which one should be taken to a hospital? Dr. Kemi, someone needs your attention, please, ma.
All right, ma'am. Thank you very much. I hope I can be heard.
Yes, loud and clear.
All right. Thank you very much, ma'am. So, yes, there are some pregnancies that can actually be managed at primary health centers. Those are pregnancies in which there is no abnormality. There is no high blood pressure, there is no diabetes, there is no particular disease that is being managed before pregnancy. You can definitely book at a primary health center. But as time goes on, if there is any abnormality noticed, the person can actually be referred to a bigger center, to maybe a secondary health care facility or a tertiary health care facility, depending on whatever abnormality is picked during pregnancy. But of course, definitely, if you don't have any disease, no sickle cell, no anemia, no abnormality before pregnancy, definitely you can book your pregnancy at primary health center. However, if there's any abnormality or there's need to see specialists, you can be referred to a bigger hospital. Thank you.
Thank you so much, ma. I'm sure that the person that asked that question has learned, because I've learned something right there. And it's not ever an okay thing to wait until it gets out of hand. We must always seek medical advice and medical care. So Dr. Kemi, please, we have another question this one is still for you. And this person is asking, can fibroids stop a woman from getting pregnant? If yes, what can be done?
Okay, thank you very much. Fibroid on its own cannot cause infertility, will not stop a woman from getting pregnant. However, if fibroid it grows in the womb, and almost all women have it. It might just be very tiny sizes, they are different in sizes. It might just, but 80%, if you take 10 women, 8 of them will have fibroid. They may not know. Of course, if it's not giving any symptoms, you will not know. So it's not as if fibroid is a disease. So it's normally will not stop you from getting pregnant. If there are a lot of people that have fibroid, they have given birth to as many children as they want, and they are fine. But when the fibroid is located in a place where it will be blocking maybe the movement of the sperm, especially if it's maybe growing somewhere close to the tube, to where it will block the fallopian tube where fertilization will take place, definitely it will. If the tube is closed, there's no how sperm and egg will meet. But and then not just close to the tube, also the cervix. The cervix is like the entrance to the womb, and it's a very narrow pathway. So if there is a fibroid, we call it cervical fibroid. If there is a fibroid close or at the cervix that is blocking the way, yes, that can also cause can be a cause of fertility. But generally, fibroid is not a cause of infertility. And then if there is fibroid, of course, at least for now in Nigeria, the best care you can have is to get it removed, which is through surgery. Thank you.
Thank you so much, Ma. Okay, now we know what fibroid is and what it can do and what it can't do. I'm sure that answer has taken away a lot of fear and, giving someone out there the reassurance that something can still be done. Okay, Dr. Kemi, please, one more question. We just want to get as much as possible from your wealth of knowledge this evening. Permit us, Ma. Someone is asking again, why is someone not seeing her period for the past 2 months now and there are no signs of pregnancy?
Okay. Thank you very much. If it's someone that is sexually active, please do a pregnancy test. Be sure that you are not pregnant. Sometimes you may not have pregnancy symptoms and you are pregnant. I will use myself as an example. When I'm pregnant and I don't know, I won't feel anything. I will be as fine as normal. But the day I will do test and it's positive, all the symptoms of this world will start. So please do a pregnancy test. And then if you do a pregnancy test and it is negative, then you need to find out why. Then you need to visit a hospital. There are tests that can be done to know what could be going on. Sometimes if there is hormonal imbalance, there's something we call an ovulation and so many other things. So you need to really visit someone that have the knowledge of doing the test and what to do. Thank you.
Okay, that was very interesting and very straight to the point. Please do a pregnancy test before jumping to conclusions. We have one more question for Nostega. And this question is postpartum related. Okay, baby care. So the person wants to know, how should you protect okay, let me get this. How do you protect your newborn from diseases? I'm sure the person is coming from a point where, a mother puts to bed and everyone is coming to hug, carry, give kisses and the likes. So, new mothers always have, all those fears, and they really should. So, Nastega, please help us do justice to this question. How
Thank
do you
you.
protect your newborn?
Thank you. Thank you so much.
Okay.
And I believe it was this ideology that made, us just adopt this pattern where before a woman goes to church, for example, she has to spend like 2 months in the house, or some people do 3 months. And then at the workspace, of course, you have like maternity leave. All is you're saying that this baby is new, this baby is fragile, this baby's immune system is still picking up. Remember when the baby was inside of you, the baby was depending on your own immune system. So now that you have brought this baby out, this baby is trying to, develop his or her own. So it's a valid concern. That's what I'm trying to say. So one of the things you can do to promote safety for your baby is you can get a hand sanitizer, a small hand sanitizer in your house, for example. Anybody that comes, you want to carry my baby, go and wash your hand first. Go and wash your hand before you carry the baby. I don't know, but we practice it. Or there is just a small hand sanitizer that we give to you. You spray, clean your hands, sanitize your hand before carrying the baby. That's one way. If you are scared of, okay, too much people carrying the baby, yes, it's a valid concern. But one of the things you can do, because you also don't want to sound mean, like, new baby, want to carry baby. So you can have that sanitizer by your side. And of course, all of these little tips that I've talked about in your diapering, when you're wearing your baby diaper, with the cord care, how to check, is this cord, in a normal appearance, the temperature of your baby, how frequently are you bathing your baby, right? You can, when I was talking about bathing your baby, I didn't mention that you can decide to clean those, maybe the neck, the groin, the armpit, clean those areas if you feel like, oh, I don't want to bathe the baby. Especially because over here, it's really, really cold. So in my head, I'm just imagining how will you look like, with the weather and all that. So these are some of the things you can do. And of course, your environment, your baby can pick things from the air. So you want to make sure that your environment is tidy and safe for your newborn as well. I hope that answers your question.
I hope it answers the question for the listener or the person that sent in that question, because yes, you have done justice to it. Thank you so much. I'll let me now switch over. Dr. Kemi, this one is for you. So specifically packaged. They say I should drop it for Dr. Kemi and help me ask her. Is it possible to have two blood groups? I've done 4 tests from different hospitals, and 2 is saying I'm A plus, while the other 2 are saying I'm O positive. And she goes on to say, I was worried when pregnant because I kept thinking, what if I'll be needing blood? Oh, I can imagine the anxiety. Dr. Kemi, is it possible?
No, it's not possible for a person to have 2 blood types. It is one, and it will always be one forever. So in that kind of case, in this case where she has done 4 tests and 2 are the same, 2 others are also the same, are they actually standard labs? There are a lot of mix up in some labs, especially if you are in Nigeria. A lot of things happen. So there's something we call a tiebreaker. Like, you will need to you'll get like 2 standard labs this time, and then do the test at the same time. Let's be sure. Or even if you do one after the 4, yes, you have 2. So you can get a very standard lab, a lab that you are sure at least is trustworthy. Then do your blood group there. And definitely, if is one of the two groups that has been mentioned earlier, then you can go with that. Or you do in 2 places, but you really need to keep doing until you are getting one blood group. That's when you can particularly say, this is my blood group. But that 4 is really I don't get. Or are you doing it from the same lab? Were the 4 tests done in the same lab? If the 4 tests were done in the same lab, please, you need to change your lab, and you can do like another 2 standard labs. Thank you very much.
Okay, thank you so very much, Ma. We are grateful for that advice, and I'm sure that whoever sent in that question just now has listened and they will take necessary action or to prevent anything from happening later on. Oh, okay, so we are almost at the end of this webinar, and yeah, we still have one or two questions, but at this point, I just want to um, say a little bit about Viva Femini before we give our esteemed speakers um, a turn to say their final words on bomb, birth, and beyond. Okay, so many women have stories. Many women need support. And of course, every woman deserves expert advice. This is what Viva Femini is all about. We are all about providing care for the woman, empowering the woman, the Nigerian woman. And we're building a product where the woman will be supported. The woman will find a community that will embrace her, support her through her journey, through her challenges, and give her, that sense of belonging. Because we know that women are going through a lot, whether it's in the stage of adolescence or being a new mother or a seasoned mom of 4, 5, or even at the stage of menopause. Women are going through a lot and they need that support. So Viva Femini is here to make that difference, to make sure that support is available, to make sure that support is accessible, and to make sure that the support is also personalized. So we're going to be showing a little about what we are building, and because it's almost near the time of launch, we want to give you a sneak peek into what we're building as a team for the Nigerian women. So crave your indulgence just a few seconds and we would be ready to give you that sneak peek into the product that Viva Feminine Limited is bringing your way. Okay, so is my team ready? Okay, if we're ready, let's play the demo. Thank you. Thank you so very much. That was a sneak peek into the app we're building to support every woman. And what we mean every woman, especially those who are going through their bump, birth, and beyond period. So we want to be a special partner for you through your trying phases, through your pregnancy phases, through your fertility stages. Viva Femini wants to be there for you. So for everyone watching, for everyone tuned in from wherever you are in the world, please be sure to follow us on all our social media channels, join our wait list, get on board, get in on the action in our WhatsApp community, and you will be glad that you did. So before we let our esteemed speakers say their last word, I just have one more question, and this is actually for both of them. So Dr. Kemi first. The question is, what would be your counsel for a woman that is expecting multiple gestation, as in more than one child on the way? So what would be your counsel for such a mom, especially if the mom is a new mom?
Yeah, okay. Yes, people with multiple gestation, they require extra care. And like I've said, all those other conditions that I said should not register in a primary health center, multiple gestation too, starting from 2 or 3 babies upwards, must register in a specialist center, in a place where you will have a specialist care. Because somebody that has more than one baby in utero, you are expected to fall in labor before someone that is carrying just one baby. And not just that, plans for delivery must have been made to plan whether it's going to be a vaginal delivery or it's going to be an abdominal delivery. And also, you will be seen more frequently than someone that is carrying a baby at the antenatal clinic, I mean. So if they are giving other ones that are carrying one, if they are giving them 4 weeks or 2 weeks appointment, yours may be 2 weeks or 1 week appointment, definitely. So all you need, please, make sure you are relaxed. There is no problem about carrying more than one baby. So far you are being monitored by a specialist. Please relax your mind, follow whatever instructions you are given. Make sure you don't do what your doctor did not tell you. If you have any complaint, any little thing that you think there's a change, please always get through to your doctor. And also, in preparation for delivery, it's not going to be like someone that have one baby. So please prepare for people that are actually going to be of help for you after delivery, people that can help you carry babies, people that can actually help with house chores so that you can be well relaxed. Breastfeeding more than one baby is not easy, actually. So please, and then you need to eat well, rehydrate yourself well, because you need extra for the extra that you have. Yeah, I think majorly these are the things that I want to say. And then please, I will advise women, if any doctor tells you that you are going to have cesarean section, please, from all indication, please go by it. Thank you.
Thank you so very much, Ma. You have done justice to that question, and I hope that one or two person will learn a thing or two. So the part two of that question and the last one for you, Nostega. So postpartum wise, a woman who has just put to bed for multiple babies, what would be that key advice you would give her, maybe from the point of even before she leaves the hospital or when she has gotten home? What would be that care advice, that that key one that you will say, adhere to this?
Thank you so much for that question. I think Dr. Kemi has done justice to it, but from a nurse perspective, I would say is rest. That's for me. I would say rest after delivery, especially, is not optional for you. So that has one child, but I say rest, but you have to rest is very, very important. Okay, and as much as you can, get that emotional support, get it from people around you, get help, pack your bags early before you leave. So have that, you know, that's enjoy enjoy the phase. Let me put it that way. It can be overwhelming having two babies at the same time, but allow yourself to be taken care of, allow yourself to be pampered at this time. So for me, I would say rest is very, very important for multiple babies, because you need all the you need your you need to have that psychological calmness to deal with the bundle of blessings that are coming your way. Because yeah, it can be overwhelming, but you start feeling the joy when your children start growing up. They are 2, they are 3, you are doing matching pajamas and all the matching clothes, but at that initial stage, yes, it can be overwhelming, but learn to rest as much as you can. Yeah, so that's for me, that's what I would say.
Okay, rest, 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 non-negotiable. That is the advice from Nestega. Okay, so we have come to the end of this amazing, interesting, and life-changing webinar. And we just want to say a very big thank you. I wish we could wrap the thanks in a big Valentine bundle, but you have shown us so much love to the Viva Family team, the Viva Family audience. So we want to say a very big thank you first to Dr. Oluwakemi Oshundara, our Senior Registrar Obstetrics and Gynecology in the house, and of course, our seasoned nurse, Tega Victor Oje. We are so blessed. We are so grateful that you found time to come and educate women and our vast audience about what it means to be a safe mother from conception through the journey and beyond. Thank you so very much, Ma. Thank you for your time. Thank you for sharing your wealth of knowledge. And we hope that you continue to excel in your endeavors and in your professions to bring more help to women across the globe. Thank you so very much. Okay, so this is where we call it a wrap on our webinar, and just want to say thank you to everyone that connected, everyone that tuned in. I hope you have learned something. I hope you are better equipped, better educated about pregnancy. I hope you have taken something that you can share with someone out there to help them have a better and safer experience. Please do not forget, to your sisters, to your friends, to your family, your neighbors, share the Viva Feminine story, the Viva Feminine movement. We are bringing a world-class and amazing product for the Nigerian women, and we would love for everyone to be in on the action. Tell them that's a healthcare that is accessible, affordable, and customized, and amazing, is coming straight to their door, to their fingertips in just a matter of weeks. And they will be happy that they are a part of this movement. So thank you to everyone who has worked tirelessly to make this webinar a success. And I hope you have a good night and a wonderful weekend ahead. Remember to show someone love, but most especially, show a pregnant woman extra love. They need it. Good night.